Welcome back. Tonight, CBS 46 investigating a problem so important, not everybody wants to talk about it because it's very uncomfortable.
Certainly is, but we're not afraid to expose accusations of sex abuse inside Metro Atlanta nursing homes. The CBS 46 Bulldog, Jonathan Carlson, found this problem goes beyond the abuse that is often unreported.
Guys, the safety of our elders should be paramount, but what our investigation uncovered is disturbing.
She couldn't cry out. She couldn't call for help.
The family of a woman who claims their loved one was raped in a Missouri nursing home.
You go there for care, not for destruction.
We all go in with the thought that, but this is going to be a good experience. You know, they're going to be safe.
But what happens when they're not? We analyzed Medicare data and found at least 6 Georgia nursing homes, all with reported cases of sexual abuse. These homes were all fined by the Department of Health and Human Services for those cases and not properly preventing it and reporting it. When we zeroed in on 3, we found some disturbing cases. According to the federal records we reviewed, Clinch Healthcare Center in Homerville, Georgia, a resident with a habit of exposing himself to others. That same resident found in bed with others engaging in unwanted sexual activity. LaGrange Health and Rehab in LaGrange, Georgia. A resident inappropriately touched others by reaching into their pants. Chulio Hills Health and Rehab in Rome, Georgia. A resident putting his hand up someone's dress. That same resident groping another resident's breast. That same resident also reported for incidents of violence against others, including punching another resident. We reached out to each one of those homes. All declined comment but one. Chulio Hills said in a statement in part, Chulio Hills Health and Rehabilitation is committed to providing our residents with a safe environment through our Quality Assurance Performance Improvement System, which promotes effective quality improvement through extensive internal investigation and analysis of unusual occurrences.
We know we don't get all of the reports.
We went to the state's long-term care residents advocate, who said what we've seen is likely just the tip of the iceberg.
I also think a lot of people just don't report. For the same reasons that people don't report in the community, residents are fearful.
But she says it's not just on the victims to report their own cases of abuse.
Anybody in the facility who works there is a mandated reporter.
She says there were 49 reported cases of physical or sexual abuse at nursing homes statewide in the last 2 years. But for the above reasons, the number of reported cases may not always be an accurate indicator.
It's a huge problem.
Elder abuse attorney Will Smith has seen it all.
The number one problem is that there needs to be more staff.
He says so many abuse cases not only go unreported, but they go unprosecuted.
The staff will clean the resident, maybe wash their clothes and get them ready to take them to the hospital like they normally do. And that destroys evidence.
Not to mention, many of the folks involved.
You have a witness that doesn't have a good memory of what happened.
Now to what else we found. Georgia requires employees at long-term care centers to undergo background checks, and sex offenders are required to disclose their personal information. But there are no laws requiring residents to be notified of an offender's residency. We spent weeks cross-checking names on the sex offender database with listed addresses and found dozens of registered sex offenders living in nursing homes in Georgia. It's all too much for Smith.
These are very vulnerable members of society. They're, you know, it's like when this happens to children, if it happens to the elderly, it's sickening.
We took our investigation to lawmakers at the Capitol who pledged to take a closer look at the supervision of offenders and elder care facilities in general. We'll keep you posted. I'm Jonathan Carlson, the CBS 46 Bulldog.